Hello everyone, my name is Poonam Muzmule. I'm the student of Brisang Institute. So today's topic is on blood and circulatory disorder. Blood and circulatory disorder affect the body's complex network of blood vessels, arteries, veins, and organ that transport the blood throughout the body. This disorder can lead to a serious health complication such as heart attack, strokes, and organ damage. Uh, condition like anemia, leukemia, and lymphoma affect the blood cell, while circulatory disorder like um, atherosclerosis, hypertension, and peripheral artery diseases impact on blood vessels and arteries. Recognizing the symptom like fatigueness and shortness of breath and chest pain and swelling, it is crucial for early diagnosis, treatment, which can significantly improve the quality of life and prevent a life-threatening complication. Additionally, it maintaining the healthy lifestyle and it includes a balanced diet and regular exercise and stress management. It also reduce the developing blood and circulatory disorder. Furthermore, advances in medical research and technology have led to the improved diagnosis tool and treatment for blood and circulatory disorder. For instances, imaging tests like angiography and venography in a health care professional to visualize the blood vessel and diagnose the blockage or damage. Medication like blood thinner and stain can help manage conditions like atherosclerosis and hypertension. There are some explanation about the circulatory disorders. Blood disorder. Blood disorder affect the blood cells, including red blood cell, white blood cells, and platelet. This disorder can disrupt the normal functioning of the blood and leading to various health complications. Next, it is a types of blood disorder. First, it is anemia. In anemia, a condition where a body has a lower than normal number of red blood cell or red blood cell do not have their enough hemoglobin to decrease the oxygen delivery to the tissue. Next, it is a leukemia. It is a type of cancer that affect the blood and bone marrow, and it is characteristic by abnormal increase in white blood cell. Next, it is a lymphoma. It is a type of a cancer that affect the immune system and especially the lymph node, spleen, and lymphoid tissues. Then next, it is a thalassemia. It is a genetic disorder that affect the production of hemoglobin and leading to anemia and other complication. Next, it is sickle cell diseases. Sickle cell disease, it is a genetic disorder that affect the shape of the red blood cell and leading to anemia and brain crisis and other complication. Then circulatory disorder. Circulatory disorder affect the blood vessels, arteries, and veins that transport the blood throughout the body. This disorder can disrupt the blood flow and leading to various health complications. Then next, it is types of circulatory disorder. First, it is atherosclerosis, a condition where plaque built up in the arteries and leading to hardening and narrowing of the arteries, which can causes a heart attack, stroke, and other cardiovascular diseases. um, Next it is a hypertension, high blood pressure, which can lead to heart diseases, stroke, and kidney diseases. Next it is varicose veins. In varicose veins, it is an enlarged vein that can causes a pain, swelling, and blood clot. Next it is a deep vein. In a deep vein, thrombosis, blood clot that form in the deep vein of the leg, which can causes a pain and swelling, and it is potentially a life threatening complication. Then next it is a peripheral artery diseases, it means PAD, a condition where the arteries in the legs and arms become narrow or block, leading to pain and cramping and limited mobility. It causes and risk factor. Blood and circulatory disorder can be caused by combination of genetic, environmental, and lifestyle factor. Some common causes and risk factor, which is include: first it is a family history, second it is a age, and next is smoking, high blood pressure, high cholesterol, diabetes, then obesity, then lack of exercise, then poor diet, stress. Then symptoms and diagnosis. Symptoms of blood and circulatory disorder can vary depending on the specific condition, but may include fatigueness. Next it is a weakness, shortness of breath. Next it is a chest pain, swelling, pain or cramping in the legs or arms, coldness or numbness in a hand or feet, skin discoloration or ulcer. Next it is a diagnosis of blood and circulatory disorder. It typically involves a combination of medical history, then a physical examination, laboratory test, it like a blood test, and imaging studies. Next it is a specialized test, like angiography, venography. Then next it is treatment and management. Treatment and management of blood and circulatory disorder. It's depend on a specific condition, but may include medication, example blood thinner, pain reliever. Next it is a lifestyle modification. In lifestyle modification, example is exercise, diet, stress management. Next it is a surgical intervention, example angioplasty, bypass surgery. Alternative therapies like acupuncture and massages. Then in some cases, blood transfusion or bone marrow transplant may be necessary to treat a certain blood disorder. And it preventing blood and circulatory disorder involves the maintaining a healthy lifestyle, including eating a balanced diet. Then next it is exercising regularly, not smoking. Then next is managing stress. Next is getting a regular checkup and screening. Then by understanding the causes and symptoms, and the treatment option for blood and circulatory disorder, The individual can take to step to reduce their risk and to promote health and well-being. Here's are more information about prevention strategies for blood and circulatory disorder. Lifestyle modification in this healthy diet, eating a balanced diet rich in fruits, vegetable, whole grain and lean protein can help lower blood pressure and cholesterol level and a risk of blood clot. Next, it is a regular exercise. Engaging in moderate intensity exercise such as brisk walking and cycling or swimming for at least 150 minutes and can help to improve the cardiovascular health. Next, it is a weight management. Maintaining a healthy weight through the combination of diet and exercise can reduce the risk of developing high blood pressure, diabetes and other condition that increases the risk of blood and circulatory disorder. Next, it is a stress management. Practicing stress reducing technologies such as meditation, yoga, or deep breathing exercises can help to manage the stress and reduce the risk of blood and circulatory disorder. Then next is risk management, risk factor management. First it is blood pressure management. Working with healthcare provider to manage high blood pressure through a lifestyle modification and medication can reduce the risk of blood and circulatory disorder. Next, it is the cholesterol management. In cholesterol management, managing the high cholesterol level through a lifestyle and modification and medication can reduce the risk of blood and circulatory disorders. Next, it is a blood sugar management. In blood sugar management, managing the diabetes through lifestyle modification and medication can reduce the risk of blood and circulatory disorders. Next, it is a smoking. Quitting smoking can significantly reduce the risk of blood and circulatory disorders. So next it is regular health checkup. Checking a blood pressure. Regular blood pressure check can help to identify a high blood pressure early when it is easier to treat. And then cholesterol checks. um, a regular checkup the cholesterol can help to identify high cholesterol level early when it is easier to treat. Next, it is a blood sugar. Check the regular blood sugar can help to identify the diabetes early when it is easier to treat. Next, it is a physical exam. Regular physical exam can help to identify and signs of the blood and circulatory disorders early when they easier to treat. And other prevention strategies like aspirin therapy. Taking a low dose aspirin regularly can help to prevent a blood clot and reduce the risk of heart and stroke. Next is compression stocking. Wearing a compression stocking can help to improve blood flow and reduce the risk of deep vein thrombosis. And then next it is regular food care. Practicing good food care such as trimming toenails, and wearing a well-fitting shoes can help to reduce the risk of foot ulcer and other complication. Thank you.